Assalamualaikum and hello to Prof Zainal. My name is Haziqah Khairiyah Binti Shuhaimie and my matrix number is BM23110047. So for my SSM assignment, I'm going to talk about the cardiovascular system. So for this slide, these are all the agendas and also the content of my presentation. First, I'm going to talk about the definition and function of heart. Second, I'm going to talk about the heart anatomy and histology. Third, I'm going to talk about the disease related to heart and well-known cardiologists. And lastly, I'm going to talk about the conclusion. For the first content, which is about the definition and function, I'm going to talk about the definition first. So, heart is a muscular organ that pumps blood through the blood vessels of the circulatory system. In human, the size of heart is approximately same as the size of human closed face, and it is located between lungs, which is in the middle of chest compartment known as mediastinum. Besides, heart is also located superior, anterior, and posterior to the diaphragm, sternum, and also the vertebral column respectively. The shape of heart is broad at the superior surface and it is tapering to the apex. And the size of heart is differ among people because it is based on some factor, for example like sex and physical activity factor. Usually, the size and weight of female heart is smaller on average compared to the male's heart, and also normally the heart of a well-trained athlete it is much bigger and larger compared to those that is non-athlete. Next, which is about the functions, there are three functions of heart. So the first function is the first function of heart is to pump out the blood through the body, in which the heart contracts to deliver oxygen along with the nutrient, hormone, and other essential substances in blood. The second function of heart is to generate the blood pressure, in which the heart creates the force necessary to push blood through the blood vessels, and the pressure is known as the blood pressure. Thus, sufficient blood pressure is crucial to ensure a proper blood flow to the organs and tissue. And the last function of heart is it is involved in electrical conduction system. Moving on to the second content, which is about the heart anatomy and histology. Sam, I'm going to look into the anatomy first. Okay, so as for the anatomy, heart is comprised of valve, chamber, interventricular septum, pericardium, and also the blood vessels. Each of those structures play their own distinct role. For example, like valve, it is essential to prevent the backflow of blood, and there are four different kinds of valve in human heart, which are tricuspid and mitral valve under the atrioventricular valve, and aortic and pulmonary valve under semilunar valve. The next structure, which is about chamber, humans have four heart chambers, which are two atria and also two ventricles. So basically, those chambers are filled with blood in which the deoxygenated blood flows to the right atrium from the body through the vena cava and pumps it to the ventricle, to the right ventricle to be specific. The right ventricle pumps that deoxygenated blood to the lungs. Then the left atrium will receive oxygenated blood from the lungs and pump it to the left ventricle. And lastly, the left ventricle pump that oxygenated blood into the rest of the body through the aorta. And the third structure of heart is the interventricular septum. So basically that septum, it is actually act as a partition to divide the right and left chambers of the heart. And for the fourth structure of heart, which is the pericardium, pericardium Pericardium is a double-walled sac that consists of parietal and visceral layer that covering the heart. And both of that layer, which is parietal and visceral layer, they are separated by fluid. And for the last structure of heart is a blood vessels such as pulmonary trunk, aorta, and also the vena cava that are responsible for transporting blood. Okay, so next, moving on to the histology of heart. As stated in the slide, the muscle of heart is known as the cardiac muscle, which is quite different from other muscles in human body. For instance, cardiac muscle has the presence of the intercalated discs, which are very important to ensure the muscle contract synchronously. Besides, cardiac muscles are striated, have one or two nuclei that's centrally located, and shorter than the skeletal muscle. And lastly, the cardiac muscle is also involuntary and controlled by the autonomic nervous system. For the third content, which is about the disease related to heart and also the non-cardiologists, I will first discuss about the disease first. The disease that I'm going to talk about is the coronary artery disease, or also known as ischemic heart disease. So coronary artery disease, it is actually happen due to the narrowing or blockage of coronary vessels. The vessels get narrowed because of the formation of plaque that is composed of cholesterol, and that cholesterol gets accumulated in the artery, cause a limitation of the blood supply. Thus, a limited amount of blood can reach the heart muscle, and in the future time, it will cause some symptom, for example, like a chest pain, shortness of breath, and also heart attack for the severe cases. So, what are the risk factors that cause this disease to happen? So, as written in the slide, the risk factor that can contribute to this disease is first high blood pressure, smoking habit, diabetes, and also high cholesterol. But thankfully, there are actually treatment to those who's having this disease, which is a bypass surgery. So basically, bypass surgery, it is actually a treatment that create a new path for blood to flow around a blocked or partially blocked artery in the heart. So the surgery involved taking a healthy blood vessels from the chest or the leg area, and then that blood vessels is connected below the blocked heart artery, and a new pathway is produced, and that pathway can actually improve the blood flow to the heart muscles. So I think that's all for the disease. So now let's briefly take a look take a look on cardiologist doctor, Malaysia cardiologist doctor, which is Datu Dr. Akmal Arshad. So basically, Datu Dr. Akmal Arshad is a cardiologist that has been working at Clinicals Hospital Kuala Lumpur, and his subspecialty is an interventional cardiology. Okay, so I think this is the last slide. Okay. And now we have come to the very last slide in my presentation, which is about the conclusion. So the thing that I can wrap up in this presentation is heart stands as a life-sustaining engine of our bodies. It tirelessly pumping blood and delivering vital oxygen and nutrient. When its rhythm falters or become abnormal, the consequences are dire, impacting the overall health. And non-functioning heart lead to a severe condition like heart attacks and heart failure. So to safeguard this crucial organ, which is the heart, prioritize a balanced diet, regular exercise, stress management, and avoiding harmful habits like smoking is very important to approach. So this practice can fortify the heart's resilience, ensuring its enduring contribution to our well-being and longevity. So by saying the conclusion, I think it's the end for this presentation video. Thank you for listening attentively to my presentation. That's all from me. Once again, thank you.